Hi guys! So welcome back to our channel. So today we're going to be discussing about urinary tract infections. So urinary tract infections, bacterial vaginosis, yeast infections, a lot of times the symptoms can be pretty confusing and are commonly mistaken for each other and therefore treated incorrectly, potentially causing complications.
Hi, I'm Sunny.
And I'm Michelle,
and we're pharmacists on call. According to a study, about 50 to 60% of women experience UTI in their lifetime. So today we'll talk about this UTI that's very common in women. We'll talk all about the causes, preventative measures, how to identify and treat urinary tract infections. So how can you tell that what you have is a UTI or urinary tract infection versus a bacterial vaginosis or a yeast infection?
So no, it's not uncommon for these infections to present simultaneously at the same time, and even for sexually transmitted infections to share the same symptoms, which is why seeing your doctor is very important. But generally we can differentiate the three by their vaginal discharge. Urinary tract infections usually do not have abnormal discharge, whereas yeast infections and bacterial vaginosis do have some type of a unique vaginal discharge. Yeast infection is usually like more like a cottage-like discharge, but generally does not have an odor to it. Whereas bacterial vaginosis, they do have a discharge, but they have more like a fishy type of odor, and usually the discharge is more like yellowish or greenish or grayish in color.
So what are the common symptoms of urinary tract infection or UTIs? So the most common symptom is the very painful burning sensation when you're urinating. Unlike bacterial vaginosis and yeast infection, where the painful burning sensation is more localized to the vaginal area, urinary tract infections tend to have this painful burning sensation coming from a little bit deeper part of the body.
Yeah, so when I have gotten the UTIs in the past, it felt like I was urinating knives.
Oh yeah, that's a perfect analogy actually, yeah. And another common presentation in UTI is something called urgency. So you have this urge to go to urinate when you actually don't have to. And other times you may see blood in your urine. And sometimes your urine itself can be cloudy and have a foul smell to it. In severe cases, you might have lower abdominal, lower back, or pelvic pain. And sometimes you could even have fever, chills, nausea, and vomiting.
So another way to test if you have a UTI is by using a testing kit that's available over the counter. So this is a dipstick test that tests for leukocytes and nitriles. But according to a medical journal, this type of test when used alone is not the most sensitive, so it may give you an incorrect reading.
But whether you have positive or negative results, if you have symptoms of UTI, you do have to go see your doctor immediately because there's no available treatment for UTI over the counter. And at the doctors, they're going to send your urine sample to the lab to test for what kind of bacteria is growing in your urine. And they're also going to test to see which antibiotic the bacteria is susceptible to.
So are there treatments available over the counter? So unfortunately, there's no treatments available over the counter. The stuff that are available over the counter for urinary tract infection are more for symptom relief treatments, which help with the painful burning sensation of urination. But because these don't really treat the underlying cause of the infection, we only really recommend these only to carry you through until you see your doctor. That's why it's important to see your doctor immediately.
Untreated urinary tract infections can lead to more serious infections like kidney infection. Early treatment could have been a short-term antibiotic course, but if it was left untreated or if it was incorrectly treated, it can lead to a longer duration of therapy. And in some cases, if it gets really bad, you might even have to use IV antibiotic. And as infusion pharmacists, we see this all too often.
Now then, let's look at the symptom relief medications available over the counter. So the first one is called Azo, which is a very popular over-the-counter symptom relief medication. The active ingredient in it is called phenazopyridine. Phenazopyridine is a dye that binds to the urinary tract lining, and it works to numb, to decrease the feeling of burning and painful urination. And because it's a dye, you will see a bright orange color urine. It's also possible that the use of these can actually dye your contact lens, so you really want to be careful. There's also something called Cystex, which is available over the counter, which has both a pain reliever and an antibacterial property.
So you went to the doctor and got antibiotic. What do you have to remember? You have to finish the entire course of antibiotic that was prescribed to you. And this is really important because not only do you want to kill off the bacteria completely, but also if you If you prematurely stop the use of antibiotic, you could increase the risk of growing antibiotic-resistant strains of bacteria. So next time on, you might get a UTI and the antibiotic might not work to kill off the bacteria and actually cure the UTI. And depending on which antibiotic is prescribed to you, there may be dietary restrictions or drug interactions with birth controls or even multivitamins, and even increase in light sensitivity. So talk to your pharmacist before you start your antibiotic.
How can we prevent this really painful, really uncomfortable infection? So one of the most common bacteria that causes UTI is called E. coli, which is commonly found in our stool and our rectum. So wipe from front to back. If you wipe from back to front, you may migrate the E. coli to your vaginal area, which can increase the chance of you getting a UTI.
Urinate post and intercourse. Urethra, which is a tube connected to the bladder, is very closely located to a vaginal opening. So when having an intercourse, it's possible to have the bacteria introduced to the urethra and into the bladder, causing a UTI. Urinating immediately after an intercourse will flush out the bacteria that could potentially go up the urethra.
So empty your bladder regularly and fully. We want to flush out the bacteria, not hoard them, which can increase the chance of us getting a UTI. And don't forget to drink enough water throughout the day.
Vitamin C. So some studies have shown that vitamin C could enhance the release of nitric oxide in the urine. And this has an antimicrobial activity against 3 of the most common bacteria that can cause UTI. The general recommendation is 500 milligrams of vitamin C twice a day.
So according to a study, cranberry juice contains compounds that may prevent E. coli cells from attaching to the urinary tract lining. However, the actual benefit of using cranberry juice for UTIs has not been fully well established. Could it hurt? Probably not. Unless, of course, you're drinking one of those that are packed with tons of sugar, then drinking the cranberry juice will probably be worse than not drinking it.
So side question, why is it more common in women than in men? It's because of the anatomy of the body. In women, the urethra is a lot shorter than it is in men. So even for the bacteria to travel up to the bladder, it's a lot shorter distance for women than it is in men, which is why it's more common in women.
So can UTI be transmitted during an intercourse? So UTI isn't a sexually transmitted infection and is not considered contagious. However, you can pass the UTI-causing bacteria between partners. However, if you already have a UTI, penetration may reinfect you or introduce you to a new source of bacteria. This can lead to a longer recovery time, so try to abstain from intercourse when you have a UTI. And that's it for today. We hope this video was helpful and informational to you. Thanks for watching.
See you in our next video. And remember, we're always on call for you. Bye!
Here we go now.